Hello again, good folk. I'm going to now show you how to wash a person that is bead bound. That means they can no longer get out of bed. First of all, you need to gather your supplies. You will need at least 3 towels and 4 to 6 washcloths. When I say 4 to 6 washcloths, I'm talking about you washing the person with a second person helping you. A family member, perhaps one of your older children even, can help out. It just makes the process go quicker for the patient, but it can be done slowly by one person too. You'll need a basin, like a biggish basin and a smallish basin, filled with hand hot water, not tepid water, hand hot. This water gets cold very quickly. I would suggest that you boil your jug and bring that into the room as well. Here I have a glass jug with boiling water in it to keep the water warm. And the reason why we have 2 bowls of water is we have wash water and rinse water. The wash water you use to apply the soap and wash the patient, and the rinse water you use to remove the soap from the skin. A wee trick that helps the removal is to put a bit of body oil, baby oil, olive oil, rice bran oil, any kind of oil. We are using today a bit of alpha curry oil, and you just pop that into the rinse water like that. We're now going to talk about the bed. In your home, you may not have access as yet to a hospital bed like we have here. So it might be a good idea to speak to your health professional, or if you're under the hospice nurse might be able to point you in the right direction so that you get access to a hospital bed. If you are unable to access a hospital bed, what you might consider doing is raising your own bed on blocks when the person's no longer able to get up, obviously, and it'll just help your back while you are caring for the person. It's good to remember to care for yourself as well. I've just come in to wash you today. You ready for that?
Yes, thank you.
Okay, you don't need anything for pain?
No, I'm good.
Good, all right. I have one of Denise's family members with me and she's going to help me today. All right, so Denise, we're going to start off. I'll just give your face a wash. I'm going to take one of my towels. Just lay it on the chest. Not everybody likes soap on their face, so I'm not going to put soap on Denise's face today. I'm just going to give it a gentle wipe with the rinse water. Okay, remember, first start with the eyes and use a separate part of the cloth for each eye. Wiping from the nose to the ear. From the nose to the ear. There we go. Denise, you must please tell me if I feel rough on you. People can be quite sensitive at this time. Another thing that's important to remember is that people have ears. There we go. Won't you pat her face dry, please? At this point, I would clean her mouth. I'm a great believer in using toothpaste, even on a piece of gauze or a swab. It's something that a person's used to, and it's a taste that they're used to. Right, now let's get stuck into do the wash. Always start the top half of the body. All right, so there's a towel for you. You just follow what I do. Okay. Denise, I'm going to remove the blankets from you. All right, just to this point. I will then cover the patient here. Person. I'll take one towel and place it underneath her arm. Now she's almost ready. We're going to remove Denise's nightie now. She's wearing a special nightie which has been split up the back to make it easy to remove. Denise, I'll start on this side. You start by pulling the nightie gently out. There we go. And you'll come up to this arm and over the shoulder, and then just get your arm out. One arm is out, covered. If you'll just do the same on that side. Okay, then put it up, taking it over Denise's head. There we go, and it's off. Okay, pause. So this is what the nightie looks like. It's an ordinary nightie, and all we've done is we've split it up the back to about 10 centimeters from the neckline. You do that with nighties, with men's pajama tops, men's nighties if they wear a nightie, t-shirts if they're happy just to wear t-shirts. Right, we have our nightie off. Be sure they stay warm. Right, just soap up the soapy cloths. Most people have a good few flannels in the house, so it's quite easy to use a number of them. If your friends are asking if there's anything they can do for you, say, yes please, I could do with a flannel. There we go. If you don't have enough. There we go. I'm going to pass this to a family member. Okay, you start at the fingertips. Remember to wash in between fingers as you go. People get bits of food. They've had their hands held by many people coming to visit. And they can be quite sweaty in between too. Then you just wash right the way up the arm to the underneath the armpit. There we go. All right, placing the arm down again. And you do the same with the rinse cloth to take the soap off. Them dry. I leave the arms usually rolled up into the towel, and then we'll wash the torso. Now with women, Please remember to wash under their breasts, and with everyone check their belly buttons and any tummy folds. Go in underneath, wash, rinse and dry well. Then, they're now nice and dry, we can apply some cream. Your body is your biggest organ. It really needs looking after. And a little bit of cream helps to keep the skin supple and prevent shear or pressure marks from being in bed. You know, people get very dry skin and then it doesn't really work so well. There we go. And then we will remove the towels under the arms. Okay. And then, because we've now washed up to her tummy, the panty line basically, we're going to put her nightie back on, which is also really simple. Just a question of letting go the arms, one at the top one usually, or well, if you've got somebody there helping you, that's fine. Okay, just gonna pull this towel down a little bit. There we are, round down behind the head, and then just try to align it so that you're not doing wedgies. There we are. Right, now we have finished with the top half. The middle bit we wash last. Okay. Make sure that your patient stays warm. Loosen the end of the beard. Placing the towel and a towel each under each leg. Reaching right up to under the buttock. There we go. I've noticed my water's cooling quite rapidly, so I'm just going to add a little bit of boiling water. Be careful, you don't want to burn you, and you don't want to burn your loved one. Yes, that feels better. It's a bit full. We'll start down at the toes and work our way up. You've got tickly feet, Denise? No? When accessing the back of the leg, it's quite helpful if you bend the knee, putting the foot flat on the bed, and then just wiping up and down, right down to the buttock. Here we are. And then we take the soap off again. again.
What temperature is it best to have the room at when we're doing the wash?
That's a very good question. Warm. It needs to be, it needs to be fairly warm, but don't have a fan heater on or a heat pump on. Warm the room first, because if you're washing someone and the air is moving, they're wet and they cool down. So it's better not to have moving air, but try to warm the room before you start. Of course, it doesn't need to be so hot that you can't stand it. Okay. We'll now apply some cream. Take care to remember heels. They seem to bear the most weight when a person is in bed. Ankles from when people lie on their sides. Tops of toes from tight blankets. And then again the same. Bend the leg up. The calf is upward strokes. Here we go. Yay. Take it away. Right, now you can remove the towels. Lovely. Now, when we go in to wash the groins and the buttocks, it's usually done by one person. And those cloths, as you've used them, you discard them. So you've already got 4 here, all right? So we're going to wash the front first. Soap cloth, rinse cloth. With women, making sure that you get well into all the creases. With men, if you've pulled back a foreskin, please make sure you put it back. It must go back after you've washed it. It won't go back by itself sometimes, so it's important to remember to do that. So now we've washed front groins. Now we're going to roll Denise on her side, and we're going to wash her back and her bottom. Okay, so I'm discarding now 1 set of cloths because we've used them to wash groins from the front. There we go. So now we're going to roll Denise so that I can wash her back and bottom. And then we're also going to show you how to change the bottom sheet when a person is in bed. Okay, so don't want Denise getting too freezing, so just half uncover your dear. I'm going to lift this knee up and fold it towards her daughter. And remember, rolling Denise onto her side. You can ask the person not to adjust their position, because some people feel afraid when they get too close to the end of the bed and they try to push backwards, and that can be quite hard on you. So just relax, nothing's going to happen, you're quite safe. Right, and we'll put a towel in place, wash Denise's back, rinse it, using the same washcloth, wash Denise's bottom, rinse it. What I omitted to mention earlier was if the person is able allow them to wash their own groins if they so wish, just passing them the cloths. Okay, then we'll apply a good slathering of cream to her back, checking for red marks from lying in one position for too long. Okay, good on you, Denise. We're done. We're now going to change the sheet. So, you loosen the linen. And then you roll it. You roll it up to the patient. There we go. Get your new sheet. And you line it up, making sure you've got top ends on top ends and bottom ends on bottom ends. And you tuck it in. And you do the same, but this time you roll in the other direction. It's important to tell your patient that there is now a lump in the middle of the bed. Denise, there's a lump behind you and we're going to roll you over that lump. Coming to me, roll over. That's it. Okay, so we'll bring this leg up again and this arm forward and just roll Denise to me. And if you will, that's it. Just do what I did. Beautiful, and look how lovely that is. There's no crinkles, nothing. Lovely. Denise, would you like to lie on your back again? Sure. Yeah. And we've washed Denise, we've washed her here, and we've changed the sheet.